Hello, welcome. Those of you just filing in here, welcome to our webinar today. We will be starting in just about 1 minute at the top of the hour. I want to remind you that although you are on mute, you're welcome to chat in any questions you have for us. And if we can answer them during the webinar today, we will. Just use the chat to chat in your questions. My name is Marche. I am here, the webinar director at Advice Chaser. We're so glad to have you. We'll wait about 30 more seconds and then we'll start. Thank you so much for being here. All right, people are filing in. Great. Those of you who are on your phone, remember that you can interact with us. If you have the Zoom app on your phone, you can interact with the chat. And we're excited to get started. All right, it is the top of the hour. Welcome. Thank you for joining us today. My name is Marche Butler. I am the webinar director here at Advice Chaser. Before we introduce our guests and get started, I do need to do a bit of legal housekeeping. Advice Chaser, the host of this webinar, is not a registered investment advisor. We cannot and do not give financial advice. Today's presentation is for educational purposes only and cannot be considered advice for any person's individual situation. Advice Chaser regularly hosts informative webinars such as this one, featuring a variety of knowledgeable professionals, many of whom are licensed advisors. Any opinions, ideas, jokes, or principles expressed by presenters are their own, and however true, funny, or interesting, are not endorsed by Advice Chaser. Please do not act on the information you hear today without consulting a qualified financial professional. So I am thrilled to bring you this lunch hour educational presentation on Retirement 101. As I said before, attendees are muted, but we encourage you to ask questions in that chat box. The presenters will answer those queries either during or after the webinar today as we have time. We want this experience to be as educational as possible, so please don't hesitate to ask for clarification or expansion of the material. Our moderator today is Tyler Henley. Go ahead and give a wave, Tyler. He's a financial advisor based out of North Dallas. Tyler and his firm's focus is to build, manage, protect, and transition wealth for a select group of clients. Their expertise is in retirement planning and working with business owners. Tyler is a CFA charter holder and has an economics degree from Rice University. He has a passion for serving others and loves making sense of the financial markets for his clients. Our presenter today is Andy Hardwick. Andy, go ahead and give a wave. He's the Metropolitan Public Affairs Specialist for the Social Security Administration. Andy graduated from Brigham Young University with a degree in modern languages and subsequently earned a master's degree in modern psychology. He started working in the Social Security Administration in the New York City area and in the disability program. Since coming to Houston, Mr. Hardwick has been involved in public outreach for the Social Security Administration. Tyler, I'm going to turn it over to you to remind attendees what to do if they have questions, and then we'll get started.
Absolutely. Thanks for joining us, everybody. If you have a question, down at the bottom of your screen, there is a chat box. If you hit that, it will open up a separate window where you can type your chat. And throughout this presentation, I will interrupt Andy from time to time to present those questions, and we'll do our best to get all of those. But I anticipate a lot of questions, so we'll do our best. But if we need to, we can always follow up with you after that. Other than that, I'm going to hand it over to Marche or hand it over to Andy.
It's Andy's turn now. Andy, excellent. We are ready for you.
Okay, thank you very much. As was said, my name is Andy Hardwick. I'm Public Affairs Specialist for Social Security. I'm outstationed here in the Houston area, and actually my area of work extends all the way out to the coast and down to Victoria. Okay, so, but I mainly stay in the Houston area. You can see on this first slide our website, our web address, www.socialsecurity.gov or www.socialsecurity.gov. SSA.gov. Either one will work, because at the present time, Social Security offices are closed to the public except for dire need cases. Most of us are working from home. If you think that you qualify as a dire need case, please contact your local Social Security office, explain the situation. If we decide it's a dire need, we will make an appointment for you to come to the local office. There are only 4 or 5 people at each office nationwide. Most of us are working from home. So you'll be able to do your business with Social Security either by phone or online. Okay? Next slide, please. The common perception of Social Security is that we're there for old folks. Okay? The majority of our people that receive Social Security are older, but I want you to know that we not only have retirement benefits, but we provide survivor and disability benefits. And as I was telling some of the folks before we started, my own family has experienced all these things. So we've been through all these, and we've gotten different kind of benefits from Social Security through the years. So keep in mind that Social Security is not only when you get older, but should you become disabled, unable to work because of a physical or mental disability, you could receive disability benefits. Or should you have the misfortune to pass away, your family members, in many cases, could receive benefits. Okay. Now, Social Security is not a giveaway program. All right, you have to earn it. So in order for you to get your own Social Security, you have to have a certain number of credits, what we used to call quarters. Now we call them credits. So for every $1,470 you earn, $1,470, you get 1 credit. Once you earn $5,880 for the year, you have gotten 4 credits. That's the maximum amount of credits you can get per year. So whether I earn $5,880 this year or $105,080 this year, I'm still going to get 4 credits. That's the most credits you can get. Now, this doesn't determine how much Social Security you get. It only determines, can you receive Social Security? In order to receive Social Security when you become retirement age, you have to have a minimum amount of credits. The work credits that are required right now are 40. So 4 credits per year, that would mean basically about 10 years of work. Now, that doesn't mean that they have to be 1 year after the other. You could work 1 year and get 4 credits, the next year and get 2 credits, the next year not work at all, as long as when you're ready to file, you have at least 40 credits. You have the minimum amount of credits necessary for you to draw Social Security. Next slide. You can still retire as early as 62. Okay, that is early retirement. Full retirement is anywhere from 65 to 67, depending on your year of birth. And we'll go over this in a little while. Now, if you take Social Security early, anytime before your full retirement age, it's going to be reduced, depending on how much or what period of time before your full retirement age you took it. So if your full retirement age is 66, for example, and you decided to take Social Security at 62, 4 years early, well, if we send 12 checks per year times 4, you would get 48 extra checks by choosing to take retirement early. But there's a price to pay for that. Because you're taking retirement early and you're going to get more checks, your check is going to be, your Social Security check is going to be reduced from 25 to 30%. And that does not change when you reach full retirement age, because you're asking for checks early and you're going to get more benefit checks from Social Security. Also, if you do take Social Security before full retirement age, there are limits on how much money you can earn if you're still working. So you might want to start collecting Social Security at 62, but maybe you're still working and those earnings are not going to make it possible for you to receive benefits at this time. Now, once you reach full retirement age, it doesn't matter how much money you're making. If you're still working, that is not going to reduce your Social Security at all. So if you wait to full retirement age, you'll get 100% of your benefit based on what your earnings were prior to retirement. Now, today, we have a lot of people that reach full retirement age and are still working. They feel good. Maybe there's not a lot of pressure at their job and they just want to keep working. That's fine. If you delay taking your Social Security at full retirement age, for every year that passes between your full retirement age and age 70, your benefit goes up by 8%. So let's say your benefit at 66, let's say that were your full retirement age. At 66, $1,000 a month. If you take the benefits at 62, they'll be $750 a month. If you take them at age 70, they're $1,320 a month. So, you know, at age 60, you might say to yourself, I'm not going to wait to 70. That's crazy. But maybe as you get closer to 66, if that's your full retirement age, you might say, hey, 4 years more, that's not bad. I enjoy working. I don't want to stop yet. I don't need the money. Let me continue working. And you don't have to be working. Even if you're not, you can just say, I don't want my Social Security right now. And you're going to get that 8% increase. Now, after 70, it doesn't go up anymore. Most advisors will probably tell you to wait at least to full retirement age, but it's up to you. It depends on your situation. Okay, next slide.
Hey, Andy, real quick, I had a
Okay.
good question as it relates to catching up. And obviously the big factor is how long you live.
That's right.
What is the math on that? Walk us through that real quick.
I don't have, I'm not sure if Social Security has a calculator online. I know some folks do have calculators, and I can't tell you off the top of my head that what it would take you to catch up. As you said, Collar, it depends on how long you live and things like that. So you have to look at those factors. Like some people may say, well, I don't know if I cross tomorrow crossing the street, I'm going to get killed, so I better get benefits early and not wait. Every situation is different, but there are calculators at our website and different websites that are not associated with Social Security that would tell you if you took benefits early, how long it would take you to catch up. But remember, if you're taking benefits early, if you're working, that could be a factor. That could reduce your benefits until you reach full retirement age. Now, if you're collecting benefits, so can your spouse and your children. If your kids are under 18, they can receive benefits. Now, your spouse can if they're at least 62, or if they're not yet 62, but there are children in the house that are under 16 or possibly disabled. Okay, so those normally the benefits stop for your spouse once the youngest child in the family turns 16. The children's benefits, though, they continue to 18. But for your spouse, if he or she is not yet 62, those benefits would stop. Then they would have to reapply again at 62 or wait to full retirement age. All right. So spousal benefit at 62 is about 1/3 of what you get. That does not reduce your benefits. So if I'm getting $2,000 a month, my wife files for spousal benefits at 62, she gets about $700 a month. If she waits to her full retirement age and I'm collecting $2,000, she collects $1,000 under me. And that does not reduce my benefit at all. Okay. Next slide. Oh, I'm sorry. We're here on the ExSpouse.
Oh, go ahead.
If you were married to your ex at least 10 years, that's the requirement for an ex, and you have not remarried, you could file for benefits under your ex. Now, remember I told you just a moment ago that in order for you to collect benefits under your spouse, if you're still married to them, they have to be collecting. Not so in the case of an ex. If your ex is at least 62 and so are you, you can file for benefits under your ex. All right. Even if your ex is not collecting, even if your ex is remarried, you cannot have remarried. But if your ex is remarried, that's okay. Now, if you did remarry and your current marriage ends by death or divorce, then you can file under your ex. Or if you were married 10 years to several exes, you can file under those and see which one would pay you more money. So, and that does not reduce their benefit at all. If they have remarried, that does not reduce the benefit of their new spouse either. Okay. All right, next slide. So as I said, the benefit for a spouse or an ex-spouse is 50% if they are filing at full retirement age. If they file at 62, the benefit is about 1/3. And that does not reduce the benefit of the person under whom they are filing. Okay. So you could have an ex-spouse and a current spouse filing under the same person, and one benefit would not reduce the other. Okay. Next spouse. Next slide.
And also, in
Next
order
spouse.
to access the ex-spouse's benefit, do you need to contact the ex, or how does that work?
No, because as long as you have their social security number or information about their date of birth, place of birth, things, because then we can find their number. As long as we can find their number, we can see, and they are not contacted at all. They don't know, because it's not affecting their benefits at all. Okay. So there's no reason to contact them. So, but we can tell you if they, if you qualify for benefits under your ex. That's all. Now, generally, if this was the rule, if you file for spousal benefits, Social Security is going to make you file for your own and take whichever one is higher. It used to be that if you filed for spousal benefits first and decided to take your benefits later, if you were full retirement age, you could file what we call the restricted application. And restricted application meant that you only wanted the spousal benefits because you wanted to take yours later on because you were waiting to have them go higher. Okay. Now that possibility, or that whatever you want to call it, is available only if you were born before January 2nd, 1954. Okay. So if you were born January 2nd, 1954 or later, then whenever you go to file for benefits under your spouse or ex-spouse, we're also going to make you file for your own benefits and give you whichever one is the higher. Now, that does not apply, though, to widow or divorced widow's benefits. If your spouse or ex-spouse predeceases you, you can get widow's benefits as early as 60. We're not going to make you file for your own benefits. You could just say, hey, I just want to get benefits under my deceased spouse or ex-spouse, but I want to wait to take my own later on at a higher rate. You can do that with the widow or widower, but for the other benefits, for regular spousal benefits or divorced spousal, no. Only if your spouse or ex-spouse predeceases you. Okay, next slide.
In filing for an ex-spouse, what documentations do you need? Do you need like
proof of marriage, proof of divorce?
Okay.
And proof of age, maybe not, maybe yes, maybe not. If you were born someplace else and you did not show us your citizenship papers when you became a citizen, or residency, well, you probably showed us your residency papers, but we have to prove that you're in the country legally. Okay, so if you were born outside the US, unless you came to us when you became a citizen. So otherwise, but proof of age, we used to require birth certificates, but now we have, in the US, we have a lot of contacts within the states, the state vital statistics. So we get that information automatically, and you don't even have to provide proof of your age. As far as the divorce spouse, we need proof of divorce. You have to be divorced at least 2 years and married 10. So we need proof that you married this individual and the marriage lasted at least 10 years and you have been divorced 2 years. Then you can go ahead and file for benefits if you're at least 62. If your ex is deceased, then you have to be at least 60 years old. But if they're still living, then you have to be at least 62, and they have to be at least 62. Okay, so they don't have to be collecting, but both of you have to be at least 62. Unless, like I said, if your spouse died, it doesn't matter what age they passed away. If you're at least 60, then you could file for widow's benefits. Okay, so I told you that in the beginning that full retirement age was anywhere from 65 to 67. And I would say for most of us, it's between 66 and 67, right? So if you were born between 43 and 54, it's 66. between 55 and 59, it's 66 and 2 months, 4 months, and so forth. Anybody born 1960 or later, your full retirement age is 67. No one has a full retirement age higher than 67. Okay. So how do we determine your Social Security? Well, remember I told you that you just needed 10 years, 40 credits. However, when we are calculating your Social Security benefits, we use your highest 35 years, highest 35 years. You don't have it, that's okay. You got 10 years, we'll take it, all right? Now, if you don't have the full 35 years, we'll use whatever you have, as long as it's a minimum of 10 years, but you have 0 years in there, and that will drop the amount of Social Security that you get per month. Right? It's like if you're in school, your teacher said, I'm going to average 20 of your grades. Okay. So you aced 15 of those quizzes. You got 100. So your average is 100, but you missed the last 5 quizzes. Okay. So are those 5 zeros going to reduce your 100 average? Of course. Well, it's the same thing with Social Security. If when you retire, you had 30 years of work, we're using all 30 years, but you have 5 years of zero. Now, the good news is if you continue working, every year you work, we take out a 0 and put in what you make. Like your teacher saying, okay, I understand that there were extenuating circumstances for those 5 zeros. Something happened. I'm going to let you do a makeup tests. Whatever you get on those tests will replace those zeros. Social Security says the same thing. As long as you're working, if what you made for the year is higher than one of the 35 years we used, or one of the 35 years is a 0, we'll take it out, put it in what you made, and increase your Social Security. And that happens every year about the end of the year. Okay. Next one.
One question, Andy, and this goes back to deferring or taking it early. Does waiting 6 months, do you get a 4% increase in benefit? So it is prorated.
Yes. By month, yes. We just say 8% because it makes it easier that way, but it is prorated, yes.
So if you worked 9 months, it'd be 6%.
Right.
So you can kind of do the math.
Right. Okay. Windfall elimination provision. I'm going to talk to you about 2 provisions that, might confuse some people. These 2 provisions I'm going to talk about only affect people who are getting a pension from work that they did for a place that did not take out Social Security. Now, 95% of employers take out Social Security. However, sometimes, like here in Texas, most school districts at the junior college level and below do not pay Social Security. So your TRS pension from a school district is it's based on work that you did, but no Social Security was taken out. If you also have at least 10 years of work in a job that took out Social Security, unfortunately, that pension from TRS is going to affect your Social Security benefit. Okay, it's going to reduce it. And that's under this windfall elimination provision. Now, if you worked your whole life under TRS, but at the medical center, which is under University of Texas, or at a 4-year college, which do pay into Social Security, then we don't care what your pension is. That's not going to negatively affect your Social Security. But if the pension was from a job that did not take out Social Security, City of Sugar Land, County of Galveston, then those pensions are going to affect your Social Security. So the windfall affects yours. You'll never be reduced to 0. So if you have 40 credits or 10 years of work, you're always going to get your Social Security. Okay. So that'll never be reduced to 0. So let's look at the next slide. That affects your own. The other one is the government pension offset. Remember, I told you that a spouse could get an amount equal to 50% of what his or her spouse gets from Social Security. However, if that spouse worked for an organization that did not take out Social Security and gets a pension from that place, then 2/3 of that pension counts against any Social Security spousal benefit they could get. So let's go to the next slide. That's called the government pension offset. So if if I'm getting, let's say, $1,200 pension per month, Social Security is going to count 2/3 of that. That's $800. So if my spouse is getting $1,600 a month from Social Security and I'm full retirement age and I go to file for spousal benefits, but I'm also collecting a $1,200 pension from, let's say, TRS, and they're going to count 800 of it. Well, the most I could get as a spouse under my wife is 800. So 800 from 800 is 0. So what do I get as a spouse? Because I get this pension from a place that didn't pay into Social Security, I get 0 as a spouse. Okay. Now, if my wife passes away as a widower at full retirement age, I could get 100% of what she gets. So she's getting 1,600. But if they're going to count 800 of that $1,200 pension, 800 from 1,600, I would get 800. So roughly, I would get half of what I would normally get as a widower. Okay, it would still have an impact on me. This is called the government pension offset. Okay, the only what can I say? There's a little kind of wiggle room in this one. If the last 5 years before you retire, you go to work under the same pension system, okay, but your new job takes out Social Security, then you wouldn't be subject to this. So if I'm under TRS, the last 5 years before I retire, I went to work at the medical center, or I went to work at a 4-year college, or some private institutions which do take out Social Security. The last 5 years, then I could get my full spousal pension. I wouldn't be subject to this government pension offset. Okay. Next slide. All right, I want to talk to you just real briefly about my Social Security accounts. The offices right now are closed to the public, to walk-in traffic, only if you have a dire need case, and that's by appointment. But you can do a lot of your business with Social Security online. If you have a valid email address, a Social Security number, a U.S. mailing address, or a phone that accepts, instead of, if you don't have an email, if you have a phone that accepts text messages, you can open a My Social Security account. What's the advantage? If you need a new Social Security card and you are not changing your name, you can do that through your My Social Security account. Once you start getting checks from Social Security, if you need to change your address, phone number, banks where your checks go, need to download a 1099 or an award letter, you could do all that through your My Social Security account. Okay, next slide. What about working and getting benefits? If you decide to take Social Security early, meaning before full retirement age, and you're working, that could have an impact on the amount of money that you get from Social Security. So this year it's $18,960 a gross. For every $2 you earn above that, Social Security will reduce your benefit by $1 if you're collecting and working at the same time. Now, the year you reach full retirement age, that limit goes up to $50,520. For every $3 above that, Social Security will reduce your benefit by $1 if you're collecting. Once you reach full retirement age, from that point on, it doesn't matter how much money you earn, that is not going to reduce your Social Security at all if you're collecting at that time. Okay. So, next slide.
And one question I'll add real quick is investment income. How is that calculated?
Not counted. Not counted. Only earned income. Earned income. We don't count investment income.
And that also counts for any kind of, future benefit in the 35 years of earning wages.
We don't investment income. The only thing we're counting when we're determining the amount of your Social Security are earnings, wages. Anything that counts as wages, that's what we're using, not other kind of income, not any other kind of income. Okay. So what's the most convenient way of doing business with Social Security? Online, easiest way. If for some reason you can't, give us a call at 1-800-772-1213. But you may have to wait a long time for that. So go to socialsecurity.gov or ssa.gov. And on the top where it says search, type in office locator. Office locator. put in your zip code, and you will get the phone number of your local office during COVID. Don't use any other phone numbers that you may have had prior to last year, okay? Because during COVID, we all have special numbers that you can reach us at. Don't use anything that prior to 2020. All right, so if you got the number in 2019, it's not going to work. So please do that. Go to socialsecurity.gov or ssa.gov. On the top where it says search, type in office locator. Put in your zip code and you get the phone number of your local Social Security office. Now, most of us are working from home. So what you're going to get is your phone call is going to be sparsed out among the people that are working from home, but they have access to all the electronic systems of Social Security. They can give you the same level of service that we gave you before. Okay. Next slide. Survivor benefit. 1 in 8 of you won't make it to full retirement age. So God forbid, if something should happen to you, your widow or widower can collect at 60. If they are disabled and the disability occurred within 7 years of your death, at 50. If they are not yet 50 and disabled, or 60 and not disabled, they can get benefits if they're caring for a child under 16. Once the youngest child turns 16, then their benefits stop unless they're at least 60 years old. Okay, next slide. And this applies to widows or divorced widows. The other benefit is disability. Disability is if you have a physical or mental condition that's going to keep you out of work at least a year, you could get disability. Now, disability pays you as though you were full retirement age. We make believe that you have reached full retirement age and you get disability. Now, disability is, if we go to the next slide, it takes about 3 months for a disability decision. You have to have enough credits, have the work time prior to your disability to qualify. Okay. Now, God forbid, if you have what we call one of these conditions that fall under compassionate allowance. There are over 200 conditions that are so severe that probably you could get an approval of your case in 30 days or less. Normally, it takes about 3 months to get a decision on a disability case. But if you have one of these 200 cases, 200 plus, that fall under compassionate allowance, then you would be approved in probably less than a month. So if you go to socialsecurity.gov or ssa.gov, type under search compassionate allowance, you'll see those. Now, if your condition doesn't fall under that, you still file. It's just going to take a little bit longer for you to get a decision. Next slide. Like retirement, a disability also pays benefits to your spouse if they're at least 62, or if they're under 62, caring for kids under 16. Kids get benefits until age 18. Okay, next one. If you have a child who became disabled before age 22, who cannot work and is single, they could get benefits under you. If you're receiving benefits, either disability or retirement, or if you have passed away and you had enough work credits under Social Security, that disabled adult child could receive benefits under you. Because normally we only pay benefits to kids up to 18. We don't decide whether or not they're disabled. We don't care. We just pay by virtue of them being minors. But then at 18, we get ready to cut them off. Unless they're still in high school, we may be able to extend the benefits until 19. But that's it. All right, unless you can show, so they could be 26 when you pass away, or you or your spouse starts getting benefits from Social Security. As long as that 26-year-old can show that that disability began before age 22, they're unable to work and they're single, they could get benefits under whatever parent is eligible for benefits or has passed away. Okay, next slide. Do you have to pay taxes on your Social Security? It says 40% of people who get benefits do. Now, with taxes, they're going to look at, IRS is going to look at all kinds of income that you have. So depending on what if your modified adjusted gross income is over $25,000 and you're a single person, or over $34,000 as a couple, then you're going to be paying taxes on your Social Security. Now, you can ask us to take out taxes from your Social Security benefits, make it a little bit easier for you. Okay, next slide. Medicare. This is the one that kind of throws people for a loop because they say, well, my full retirement age is 66 or 67. That means I don't have to file for Medicare until then. Not necessarily. Now, if you are working at 65 and have health insurance through your employer or your spouse's employer, you don't have to file for Medicare. If you're on disability, no matter what your age, after 2 years, you come on Medicare. So remember, I was telling you about the disabled adult child. If that 26-year-old is approved, and then what happens is at 28, they become eligible for Medicare, just like other people. Okay. Now, if you're on disability, there's a 2-year waiting period to come on Medicare, no matter what your disability is, except for ALS and permanent kidney failure. If you have permanent kidney failure, end-stage renal disease, or Lou Gehrig's disease, you can come on Medicare almost right away. Okay. There's no 2-year waiting period, but everybody else has a 2-year waiting period, unless they turn 65 before the 2 years are up, but that usually doesn't happen. Usually people on disability are much younger. Okay, next slide. So let's talk about Medicare enrollment. Medicare enrollment, initial, special, and general. If it's 65, I'm not working, and I am not covered under a working spouse under their employer health plan, I have to file during the initial enrollment period. When is that? The month I turn 65, 1, 2, or 3 months before, or 1, 2, or 3 months after I turn 65, okay? If I'm working at 65 and have health insurance through my employer, or I have a working spouse and I have health insurance through my spouse's employer, I get the special enrollment period. That means I have 8 months from the time my spouse stops working, if I have it under her, or I stop working, if I have it under my employer, that I don't have to file for Medicare. I don't get a penalty if I file within 8 months. Now, if I miss the initial and special, I can only file for Medicare during the general enrollment period, which is January to March of each year. We're in a general enrollment period right now. Now, for every year, if you're in that situation, you missed the initial or the special, and you're in the general enrollment period, for every year you were late in filing for Medicare, your Medicare Part B premium is 10% higher, and that never goes away. Okay. Also, your Part D, if you decide to get a prescription drug plan. Okay, next slide. So A and B, you come to us, Social Security. We take care of Medicare A and B. What is A? A is the hospital benefit. That's free. If you have 40 credits, or the spouse under whom you are filing has 40 credits, then you don't pay anything for Part A. That pays the first 60 days in the hospital. You have a deductible of $1,408. That's on you, which probably is your first hour in the hospital. Okay, if you've seen your hospital bills, that's probably what it is. But after that, the 60 days is covered under Medicare. That's A. That's the one that's free. Part B is not free. That's 100. Oops, this is the 2020. Okay, that's 140. Ooh, is it 145? I just got a brain freeze here and I forgot. It's a little bit higher this year for 2021. Okay, went up maybe $1 or $2 for 2021. And no, not 203. That's not it. It's not that high. No, it's like 145, 50, something like that. Okay, it's just a few dollars went up. Okay, and so that means the deductible also went up slightly to 2020. So it might be about $1,500 this year. All right. Now, Part B covers the doctor, 80% of the doctor bills, 80% of your doctor bills. All right. Now, so let's go to the next slide. But that doesn't cover drugs unless you're in the hospital. So if you want a prescription drug plan, you got to sign up for Part D. Now that you don't come to us for. Why? Because Part D are private plans. So you could go to Medicare.gov, all right, or call 1-800-Medicare. It's a 24/7 service. Tell them the medications you take, and they will help you sign up for a plan or go to one of the plans. Except if you go to a plan, you know you're not going to get an unbiased opinion because they're going to try and sell you your plan. Whereas if you go to Medicare directly, they will give you an unbiased, they'll do a comparison of the different plans. And since it's a 24/7, I suggest don't call between 9 and 5. Call after dinner, okay? You're not going to get a lot of competition. Even on the weekends, they're there on the weekends. That's the best time to get through. So that's the Medicare number. Now, if you want A, B, and C, I'm sorry, A, B, and D, you could sign up for Medicare Part C. If you have A and B, you could say, I want a Medicare Advantage plan, which could be a PPO, but in most cases it's like an HMO type plan. If you sign up for that, then the $145 or $148.50 that you're paying for the Medicare Part B premium this year, that goes to your Part C plan. That covers you. So that would cover drugs, hospital, doctor. You have a small copay. That's a real money saver for a lot of people. So that's what. So here's that 1-800. That's a 24/7 number. Okay.
And Andy, we have a couple of questions, comments regarding the 10% penalty or the 10% increase on Medicare going forward. Do you mind going over that again?
Yeah, the penalty is if you miss the initial enrollment period, and you might miss it because you were still working at 65 and had insurance, and that's okay. But then you get the general enrollment period. The initial is the month you turn 65, 1, 2, or 3 months before, or 1, 2, or 3 months after. Okay, if you don't sign up then, you could get a penalty if you didn't have employer coverage at that time. All right, but if you did, then you have the general enrollment period. You have 8 months to sign up. If you miss that 8 months, so if I stop, let's say I stopped working last January and I was 68, okay? And I stopped working last January. I had until August to sign up for Medicare and I didn't. And now I'm here. I need Medicare. So here I am. Well, I'm in the general enrollment period, but I'm a year late. So my Medicare premium is going to be 10% higher. And that never goes away. Now, also, if your income is over a certain level, $85,000 for a single person or $170,000 for a couple, then your Medicare Part B premium and Part D premium for prescription drugs are going to be higher because of your income. Okay, so some people pay higher premiums not because they file late, but because their income, they're more blessed in retirement. So they're paying a higher amount for the premiums. Prior to Part D coming along, everybody paid the same for premiums, but then Congress said, no, that's not right. So then they changed it. So that's how that works. Okay, one more slide here, and then we'll open up the questions. I know it's difficult to try to compress all this. This is for supplemental security income, is not Social Security, okay? It is for people who are blind, disabled, or 65 or older, right? So if you have a child who's never able to work, he's at least 18, because if he's 18, we're not counting mom and dad's income and assets. Under 18, if he lives with his parents, we are. In most cases, that'll make the child ineligible. But once he turns 18 or she turns 18, we don't care what mom or dad has. Only what the child has in their name. So if they get SSI, they get a money amount every month. It could be as high as $793 per month or $500, depending on what their income is and what their living arrangements are. And they get Medicaid, not Medicare, they get Medicaid. Okay. So, but this program is an assistance based on need. So there's going to be a lot of questions about income and assets of the child. Okay. Whereas with Social Security, we're not going to be asking those kind of questions because that's not a needs-based program, but SSI is. So that's just out there for your information. Okay. $794. I said $794. I was $1 off. Sorry about that. Okay. If we can go to the last slide with my, I don't know, with my contact information, if you want to save that for later on, but let's open it up let's open it up for, yeah, here it is, andy.hardwick@ssa.gov. I know you're going to have a lot of questions because it's difficult to give this in this period of time and not raise questions. But if we can't answer them today, please send me an email at andy.hardwick@ssa.gov. I'll be glad to answer your questions or refer you to someplace where you can get an answer. Thank you very much. And I guess we'll open it up to questions now, right?
Perfect. Yeah, absolutely. Marche, did you have anything to add?
You know, we aren't probably going to be able to answer every single question. So Tyler's going to choose, you know, the questions that we feel is most pertinent to the group. Once again, both Tyler and Andy, will get Tyler's information up here as well. Those are both good resources to reach out to for retirement planning.
I see a question here about max benefits. I would say max Social Security benefits are probably about $3,700. Not a lot of people get that. You'd have to be like a CEO. I'd say the average benefit, maybe depending on what your income was before, maybe 2,000, 2,400, something like that. It could be low. It could be on the higher end, but nobody's in the $4,000 range. Not as of yet. Not per month. Not yet.
And go back, question from earlier and talking about calculations of spousal benefits. How is a spousal benefit calculated when one files early versus getting half? And how does, I mean, I could read, I know that can get relatively confusing. If you're going to get half of your spouse's, does the spouse have to work to age 70 to get half of their increased amount at age 70?
This is
all
the
that
thing.
work?
Yeah, if your spouse, okay, let's say my benefit is $2,000 a month, but I waited to age 70 to collect, so now it's $2,400 a month. My spouse files under me. She's going to get half of the 2,000. She's not going to get that extra of that 400. They're not going to count that while I'm still alive. If I pass away and my wife files for widow's benefits at full retirement age, then she gets 100% of what I got. But while I'm still alive, the most she could get is 50% of what my benefit would be at my full retirement age.
Got it. Well said. I have another question regarding citizenship. Give me just a moment.
You just have to be in the country legally. You don't have to be a citizen. For the SSI program, yeah, probably. But for the Social Security, you just have to be in the country legally. And you can get Social Security almost anywhere in the world. So if you move outside the US, but be careful, if you're not a US citizen, please check on our website, put what country, because certain countries, if they don't have a treaty with the US, you have to come back every 6 months. Stay here for 30 days, and then you can go back to your country. If you leave the US as a citizen, or our country has a treaty with that nation, you don't ever have to come back to the US, and you can have it direct deposited to your bank outside the United States. If you are going to leave the US, I recommend that you drop Medicare unless you're going to be coming back and forth. But Medicare will not cover you for expenses incurred outside the United States. So if you're going to travel, get traveler's insurance, which is cheap, or if you're an HMO Medicare Advantage plan, some of those do cover you if you get injured outside. So check into that. But traditional Medicare does not. If you have A, B, and D, that's not going to cover you if you get hurt outside the US. But you can get traveler's insurance for whatever time you're out, and it's relatively cheap.
Got it. And what happens if you paid into Social Security for 20 years, now you're on pension? I'm not sure exactly what they were referring to. So whatever they paid in, that's going to determine their benefit, but then that can be further reduced by the government pension offset or the windfall elimination provision if either of those apply.
Right.
Okay. But still, okay. And then I have two people that were asking about pension benefits that are paying Social Security. Does that count as earned income? Does that add to their benefit?
No.
So
I know what you're talking about. If you're getting a pension and they're taking out, that doesn't make any sense. because that pension is not going to be used in calculating your Social Security. So why are they taking Social Security out? We only take Social Security from earned income, from your earnings, not from dividends or royalties. I think it's considered self-employment income, but anything that's not wages, not considered wages, you don't pay Social Security taxes on that. So check your stub again for your pension and see if that's correct. That doesn't seem to make any sense, because we don't take Social Security from pensions, only if it's earnings, if it's wages.
Another question, if you have filed, if you reach full retirement age and you're taking benefits and you're still earning income, do you still pay Social Security tax?
Yes. Why? Because remember what I told you, as you're working, we're going to see if we can use those wages. If those wages you made for the year are higher than one of those 35 years we used, or maybe one of those 35 years is a zero. So if what you made for the year is higher, and chances are it's going to be, because 35 years ago, 40 years ago, probably you weren't making a lot of money. And now, even if you're working part-time, chances are what you made for the year is going to be higher than one of the years we used. So we will take, you do pay Social Security, but that's because that we're going to see if we can make your Social Security go up. And that doesn't stop at 70. That goes on forever and ever. If you're working at 75 and you're making $120,000 a year, hey, chances are that's going to be higher than one of those 35 years, because you weren't making $120,000 a year for 35 years. So we're going to use it. We'll take out your lowest year, put in there that, and recalculate your Social Security benefit. And that will go on forever and ever as long as you keep working.
And one question regarding benefits for a spouse. Can a spouse get their spousal benefit if they live outside the U.S.? Or I guess it would assume that they're still a U.S. citizen, but the spouse still lives in the U.S.
Yeah. Mm-hmm. Yep. Yeah. If you file for a spousal benefit and you're a citizen, and you can get benefits under your spouse, even if you go somewhere else and your spouse stays here, that's fine. Or so you don't have to be in the same place at the same time, whatever. No, that's okay. That's all right. Now, if your spouse, if you got married outside the U.S., and then there's I think the spouse, the person that's doing the filing under their spouse, they have to live in the U.S. a certain period of time. But if you did live in the U.S. and now you're getting benefits under your spouse, and for one reason or another you move to another country, but your spouse stays here, that's okay. You can still get your spousal benefits someplace else.
Perfect. And can a widow take benefits from a deceased spouse and defer their own benefit if theirs is larger?
Yes.
Or do the rules that
Yes. Now that one, remember, with the widow or widower's benefit, for those, that one you can take that. You can take that and not take your own. We're not going to make you take your own. Yes.
But then they can file later and access their own
right
at age, before retirement age, or at 70.
Right. Mm-hmm.
Perfect. Okay. We got a few more questions here. Actually, we got a lot more questions, trying to get to all of them. Got that one.
Yeah, we'll probably take about 2 or 3 more minutes to do questions, and then we do need to wrap up.
So here's a good one that we were actually talking about this before the presentation. What changes do you see coming from Congress due to the viability of Social Security?
Well, the key year is 2035. We already know what needs to be done. If you go on the Social Security website and under search, you put in solvency, or just put I don't know, solutions to Social Security, something, you'll see all the proposals that have been put in. Some of them right now, we tax the first $142,800 of your earnings. So if you make $200,000 a year, you only pay Social Security tax up to $142,800. So some of the proposals say, well, why not tax the first 200,000? That will bring a lot more money into Social Security. Another one says, well, if people are living longer now and maybe living, let's say the new Generation Z or whatever it's called now, lives maybe to 90, maybe we should up their age, full retirement age from 67 to 68, like they did, 20 years ago or so, or 30 years ago, when they changed full retirement from 65 to 67 gradually. They may do something like that. So those kind of changes, we know what needs to be done, but your congressional representatives know that those things aren't popular. People don't like to hear that. So they kind of like don't want to mess with it right now. But you're online and send them an email. Say, what are you doing about the Social Security question? Or if you're at a town hall meeting, hey, Congressman, when are we going to do something about Social Security? They all say Social Security is a wonderful program. I said, well, then do something. So we know what's there. It's there on the website. We don't hide it. Okay. Yeah. But it's been done before. We made these changes before. We've tweaked the system before, and it's fine. So we just need to tweak it again, and we'll be good. We've been around since 1935. We're not going anywhere. Okay. It's not a Ponzi scheme or anything like that. No Ponzi scheme lasts for 85 years. Okay. So
Tyler, maybe one more question and then we will close it out. Yeah.
And I apologize, we weren't able to get to all the questions, but feel free to email myself or Andy. Love to help be a resource to you. The last one we'll go with, does your Social Security benefit increase with inflation?
Yeah, we give the cost of living increases every year. Unfortunately, the one next year, I'm sorry, we are in next year already. That's where my mind is. What was it, 1.3% or something like that? It was a small, because inflation was very small. Okay, so the larger inflation is, the larger, usually around the last quarter of the year. Actually, Department of Labor looks at that, and depending on how prices went up, down, or stayed the same, your checks will never be reduced, but either they'll stay the same. There have been some years where there was no cost of living, or they'll go slightly or higher or better than that, depending on what inflation was for the prior 12 months or so.
Well, folks, this has been awesome. Thank you, Tyler. Thank you, Andy. I just want to thank everyone for being here. I do have a short little information about some of the questions people had. Look for an email soon with a replay of this event. We know that there's more information here than you can digest in an hour. You're welcome to share that replay with friends and family. And here at Advice Chaser, we're all about helping you find a financial advisor who is a great fit for your life and your financial questions. What's great is our matching service is free to you, and every one of our advisor partners has committed to offer a free initial consultation to anyone we introduce them to. You can find out more by going to advicechaser.com and clicking on the link to find an advisor. So once again, from Advice Chaser, thank you so much for coming. We will see you at another webinar soon. Bye, folks.